The way I learned to describe and identify blood cells was by taking it step by step until it becomes reflexive. This is the cell that we were tasked to identify on the last blood smear quiz. The first thing I start with is size. What is the size of this cell in comparison to the reference cell, which almost always is going to be the surrounding red blood cells. This cell is much larger than the surrounding red blood cells. It has an irregular shape and it has an irregularly shaped nucleus. The next thing I look for is what is the ratio of the nucleus to cytoplasm. That will help you identify a lot of different types of cells. So in this case, the nucleus to cytoplasm ratio is maybe 2:1 or 3:1. Next, I look at the color of the cytoplasm and whether there's any inclusions or granules inside that cytoplasm. This cell has a sort of gray bluish cytoplasm, and you can see some fine granules in there. And most characteristic about this cell when we're looking at normal cells is the presence of those vacuoles. That, I think, is a dead giveaway for this, especially when you're trying to determine whether it is a reactive lymphocyte or what this actually is, which is a monocyte. This is a normal appearing monocyte. In a normal peripheral blood smear, monocytes are the largest cells that you're going to see circulating. These are a type of white blood cell. They circulate peripherally and they're also present in the tissues. And they can differentiate into dendritic cells and macrophages. Monocytes are going to be increased in inflammatory states, and the abnormal monocytes may be present in certain types of leukemia, such as CMML, or even acute monocytic leukemia or acute myeloid leukemia with monocytic differentiation. More info below in the caption about monocytes, and see you next time.